Welcome to Discovering True Health, where our goal is to provide you with cutting-edge health information through research, interviews with experts, and personal journeys to true health. Our message is a message of hope and healing, and our mission is to bring you on a journey to discovering true health, to not only find wellness, but to thrive. Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Also, don't forget to hit that subscribe button to stay up to date on all our upcoming shows. We also have a lot more great information on our website, Instagram, and Facebook. All those links are below. So today we'll be learning all about hormone health. Now, in a recent study of 2,000 women, they found that 47% experienced the symptoms of a hormone imbalance, and most were unaware of the potential implications, causes, and symptoms of hormone imbalances. Also, low testosterone affects almost 40% of men aged 45 and older. So we are going to learn all about hormone imbalances, signs and symptoms, testing and root causes, and some actionable steps to take to help rebalance our hormones and prevent imbalances. So my guest today is Naturopathic Physician Dr. Clayton Bostock. In his work, his approach is an integration of naturopathic and functional medicine with biohacking principles to reverse chronic conditions and create vibrant long-term well-being. So thank you, Doctor, for joining me today.
Yeah, happy to be here. Thanks for having me.
Now, I'd love to start with hearing a bit about your work. Can you share with us a bit about your work and your practice and what your approach is to health and wellness?
Yeah, I mean, that's kind of a loaded question, but, or it might be a long-winded question, but yeah, I've been practicing, this is my 7th year in practice. I kind of have two different sort of practice, basically two different practices. I've got an online consulting practice. That's kind of my big passion. That's when I work with people in different programs, and we really spend some time and some one-to-one time where I can kind of impress like all of the things that I know that lead to like optimal health. Typically those are patients with a more chronic, long-standing condition, like an autoimmune condition, but I do a lot of like health optimization for those types of clients as well. And then I actually do still work I do have a brick and mortar style practice where I practice a lot of like family naturopathic medicine, but a lot of hormones and digestion. And those are that's kind of the way that I cut my teeth and kind of gain some of the skills that I use in my consulting practice. But yeah, just kind of fell into naturopathic medicine, really never had a dreams of being a healthcare provider growing up. It just sort of got led into it. And after I kind of looked into it, did some research, the rest was kind of history. I've been quite passionate about it ever since. So love the work that I do.
Yeah, so important, especially, the diverse approach to it. You do both sides and you have this holistic approach, and it's so important, especially with the gut health and the hormone health. And that's great that you also do the online, because then you can reach so many more people and help so many more people that way, especially now.
Exactly.
Everything going on. we need more doctors online.
For sure. Yeah, and lots of people are moving that direction for sure.
Yeah, so helpful. Now let's kind of dive into hormones, and let's kind of maybe start with the basics so we can get an understanding. What types of things are hormones responsible for in our bodies, and why is it so crucial to keep them balanced at healthy levels?
Yeah, I mean, hormones, they're basically signaling molecules, right? What they change the response of our cells on a micro level, but really on a macro level, they're responsible for so many different sort of physiological functions. So they're involved in our metabolism, our blood glucose control. So you consider hormones like insulin, your thyroid hormones, growth and metabolism. They're involved in obviously reproductive function when you think of the sex or steroid hormones like testosterone, progesterone, estrogen, DHEA, and then they're also like those particular hormones have more than just a reproductive function. They're involved in just neural function, so brain function. They're involved in just mood, a whole bunch of different basically functions that hormones do. And there's a whole bunch of different types of hormones essentially.
They're very important for many things. And you mentioned cellular level, and, we're only as healthy as our cells. So that's vital. Are there kind of a certain few top most prevalent hormone imbalances that you see that we should be aware of, or, so like several that are kind of the most common?
Yeah, there certainly are. So, I mean, most of these people are going to be aware of, but thyroid hormone imbalances are a huge thing. Deficiency being probably the most common one. So you think of hypothyroid or Hashimoto's. In women's health, a lot of times, a lot of your listeners are probably familiar with the kind of like the term or the phrase estrogen dominance. So that refers to just, too much estrogen relative to progesterone. And that can lead to a lot of the different, menstrual type symptoms that, women can experience. It can be involved in conditions like PCOS, endometriosis. And then another, like probably the third most common one that I see is cortisol imbalances. Really just, I describe it as just like a burnout pattern is probably the most common one. Cortisol can be obviously too high and it can be too low. You don't really want either of those. Those are ideal states. More of a balanced cortisol response is what you're looking for. But those would be probably the most prevalent is thyroid, estrogen imbalances in estrogen, progesterone, and then issues with cortisol. Another one that we don't really think too much of a hormone is, even though it is insulin. Insulin resistance is another really common one nowadays.
Got it.
So you can get an imbalance in that, in the sense that you just have too high of insulin.
Right. And what would like some of the signs and symptoms of hormone imbalances? It sounds like there's quite a few hormones that could be imbalanced. Are there certain, particular signs and symptoms we should kind of have an awareness around?
Yeah, for sure. I mean, some of those signs and symptoms, I don't just work as a hormone doc, but I do a lot of hormone replacement or hormone work. It doesn't always have to involve replacing hormones, but I would tell you, like, kind of the most common conditions that like really any doctor sees, which would be fatigue, it would be depression and anxiety, it would be poor sleep. Those are a lot of times, those are a result, or can be, hormones can be underneath all of that. That doesn't mean hormones is always the root cause. I like to say, well, okay, if your hormone, like, why are your hormones off? There's a root cause underneath that. If you keep asking why, there's always kind of a reason behind things.
Mm-hmm.
But kind of the big players, or the most common types of symptoms that people are dealing with nowadays have very close ties to hormone levels and are affected by hormone imbalances essentially.
And now what are the types of testing? Let's say you're, experiencing some of these types of symptoms. What are the best tests to have done to, pinpoint what type of hormone imbalance, or if it is actually a hormone imbalance?
Yeah, good question. So it depends on the hormones that you're trying to test. Every practitioner is probably going to have like a different take on this. There's some hormones that I will look at in blood. So example, thyroid, testosterone, those types of things. There's other kind of like functional labs where you can do a whole hormone panel based off of salivary testing, based off of urine testing, which is probably the most common that I use nowadays is urine testing. But a lot of times I'll do a mix of basically blood testing and urine testing. Less frequent nowadays, I'll use saliva, but there's certainly, if you can't get your family doctor to test certain hormones, there's lots of different like naturopaths or functional medicine doctors who have other ways of testing hormones other than just kind of your routine blood work.
Got it. Now, you mentioned previously root causes. What would be some examples of root causes of hormone imbalance?
I would tell you right off the bat, and it, again, depends on the hormones we're talking about, but right off the bat, stress is probably your biggest one. I think most of us, I always mention this to patients, is okay, when I ask a person about their stress, they're like, yeah, you know, I don't have too much stress. Well, I would argue that literally just like, even if you're kind of the average person, you're working 40 hours a week, 5 days a week type of thing, you don't have any significant stressors in your life currently, I would just argue just even that sort of daily lifestyle and routine, going back and forth from work, looking after a family, that to me is enough of a stress to affect someone's hormones. On the opposite end of that spectrum, it's like, yeah, you've got some type of crazy financial, work, relationship, or business stress going on to add into your kind of already daily stressors. Then that's probably one of the biggest root causes. There's other root causes, there's other issues to consider, certain nutritional deficiencies. You need certain nutrients as the building blocks of certain of hormones. Infections can be an issue. Toxins. So we talk about endocrine disruptors a lot nowadays in the environment. Yeah, those are kind of like the heavy hitters. There's all types of different, I mentioned stress to begin with. There's all types of different stress. There's obviously mental stress. There is physical stressors. One physical stressor that is always on my radar nowadays, and it's becoming a more prevalent thing, is concussions. So having head trauma can negatively affect kind of your master hormone gland. It's called the pituitary. And this is now a well-known thing that even whiplash can affect this. But essentially, any type of head trauma, what happens is the pituitary gland, which is basically above the roof of your mouth, it sits in a bony structure. It's called the sella turcica, and then the pituitary is kind of like a sort of a little grape-like gland that sits there. And if you hit your head and it bounces, and your head bounces around, well, that pituitary can bounce around in that bony structure, and you can have circulatory damage, you can have nervous tissue damage, and then it's called hypopituitarism. Your pituitary is still working, unless you have some very severe head trauma, but it's a known thing now that people, like years after a concussion, doesn't have to be a major concussion or whiplash or something, or multiple head injuries, their hormone levels actually or a lot of people, their hormone levels can start to decrease. And, 10 years down the line or whatever, people can start to have brain fog or fatigue or depression, etc. And there's not really any known cause. Well, it's a known thing now that head trauma can be a huge physical stress that can affect your hormones. Months down the road, years down the road.
Wow.
So that's one of the kind of things that I always screen for now around hormone imbalances.
So there's a way to specifically test for that type of the pituitary damage?
No, well, indirectly, I don't know a way to do it, but you can assess all the hormones essentially downstream from pituitary function. There's actually a particular lab that I'll use based out of Florida. And it's a hormone, it's a TBI, traumatic brain injury based hormone panel. This is the work of a guy named Dr. Mark Gordon, quite a brilliant guy. He's been on a couple of Joe Rogan podcasts, but he also has a documentary out on Amazon Prime. It's called Quiet Explosions. And that's kind of where I learned all this stuff from. So he's an endocrinologist, brilliant guy, has a lot of trains physicians on this work, how to assess it, how to treat it, that type of thing. And I would encourage anyone listening who this is interesting to is to watch that documentary, because a lot of times people don't, there's no known cause for some of the symptoms that they're experiencing. And yeah, literally it can be from previous head trauma. Lots of military people, lots of football players, hockey players. Just really anyone who's had, a car accident or sports injuries or whatever that have to do with head trauma.
Wow, that's interesting. I was going to say, it makes sense, Joe Rogan, because he's in that kind of the MMA world. And
Exactly. Yeah,
a lot
those
of
guys, I
that's
mean,
not going on.
they're probably the worst for it, right? Boxers, MMA guys taking blows to the head consistently. And that's the thing is like the more concussions you have, just literally the easier it is to essentially get one again, right? I've had a number in my life. And I remember when I was living in Vancouver, obviously a very rainy area, sort of the pathway down to my house was like it had rained for probably 2 weeks, and I was walking down the pathway, slipped and fell on my butt, and literally like got concussive symptoms from that. So you don't, if you've had previous concussions, it doesn't take it doesn't necessarily take a huge trauma or blow to the head to essentially repeat those symptoms.
Wow. So it just could be like a jostle, your body could get kind of a jostle or jolted.
Yeah. Yeah. And like I say, whiplash is another thing I screen for too, because it can be, people think, oh, it was just whiplash, it didn't hurt my head. Well, similar things can come out of that, similar to concussion symptoms.
That's so interesting. And is that gland where a lot of the hormones are produced? Is that why it causes the imbalance?
Basically, what the pituitary does is it sends signals to all your hormone glands, or a good majority of them. So it'll send signals to the thyroid, and that's a hormone called TSH. That's the main screening hormone that they will do for your thyroid. It'll send signals to your your adrenal glands. It's called ACTH. It'll send LH and FSH when you go and get tested for fertility. Those are the hormones that go to either the ovaries or the testes, and they cause an increase in production of the hormones like testosterone or progesterone or estrogen that those glands produce. So basically, yeah, if the pituitary gets damaged, it doesn't send, or it's not functioning quite as good as it should, and then those signals to all those glands from the brain, from the pituitary, are impaired, and then the glands themselves aren't producing sufficient hormones.
So the signal's not working, which
Exactly, that's exactly what it is.
from producing
You said it way easier than I can.
and is that something that is, once it's damaged, is it reversible? Can it be healed? Is there something we can do to get it functioning properly again?
Yeah, I mean, I would say like I would tell you, it probably depends on the amount of, like, if there's been severe head trauma, a little bit different story. But a lot of the times, these people who are, they're irritable, they're depressed, they've got fatigue, they can't sleep, brain fog, etc. When you do, a lot of times it does involve hormone replacement. It doesn't have to. There's other things you can do to kind of help balance those things too. But I would tell you, a lot of times it can make a massive difference, because from a head injury, there's kind of the way that I was taught, there's kind of two injuries. There's the actual initial injury where you get some type of blunt force to the head, or however you get injured. So that's your initial injury. And then why I said this can happen for literally years, months, decades ongoing, is that can set off basically oxidative, essentially just prolonged inflammation and oxidative stress at the brain level. It's low grade, right? But it's just under the radar, consistent, and just over time that damages brain function, damages nerve function. And then people can end up depressed and all those different types of symptoms that I rattled off about that.
Wow, that is fascinating. And that's so good to know. I mean, I've had a lot of concussions in my life, so I'm like, oh, maybe I need to.
Yeah, and I don't want people listening to this to think, oh my goodness, that's me. That's good. Like, because it's a certain percentage of people, like some people can totally recover, right?
Yeah.
But it's just like, it's something to be on your radar if you've got some type of health condition and there's no known cause for it and nothing's helping it, to be like, hey, well, maybe this is something that's could potentially be going on for me.
Right.
I'll tell you, when you look at people's hormone panels, I literally just got one of the TBI panels back today for one of my patients, ex-pro athlete, and yeah, I mean, some of the results, it's like, okay, well, yeah, this is why you're not feeling 100%, right, or a big portion of it. So
And that's really the
Yeah.
fascinating part, that and why I love naturopathic doctors so much, is because you really look for those root causes. You could have, other doctors that don't have maybe the extensive kind of holistic approach might just be like, oh, your hormones are off, let's give you some hormone replacements or supplements, or and don't necessarily find those root causes to kind of where it's coming from.
Yeah, I mean, just like to touch on that though too. I mean, a lot of times it's like you go to an anti-aging doc, or like, yeah, some type of like an OB/GYN, or someone who just does bioidentical hormone replacement. And I mean, hormones are powerful things. So a lot of times people can feel like really good on hormone replacement without necessarily finding the root cause, right? So doesn't mean you always have to, but it doesn't mean you always can find the root cause too. That's another thing to consider. But yeah, I mean, it's like, that's kind of one of the principles of naturopathic medicine, is you want to treat the cause, right?
Yes,
Yeah.
absolutely. And you kind of touched on this as well. What are some holistic ways to kind of rebalance a hormone imbalance? It sounds like, there are ways to, hormone replacements, but are there holistic ways? Let's say I had a hormone imbalance, things that I could do without some sort of medication or treatment to help get my hormones back. I guess it would depend on what it was specifically.
Yeah, I mean, it would depend on your symptoms, but I can just give some kind of like foundational things that people, I mean, a lot of times, yeah, you don't need to use any type of hormone replacement. But I mean, easier said than done, eliminating or decreasing stress. Um, Sometimes, I mean, stress is unavoidable. Sleeping really well. Most people don't even know what good sleep is anymore. I've got some like pretty pillar sleep hygiene things that I have all my patients do. Circadian rhythm, that's a thing that's a little bit fringe, but a lot of people are aware now of like the health impacts of having a proper circadian rhythm, because that rhythm controls the release of your hormones. I mean, there's some pretty simple steps. That's kind of an aside. There's some simple steps that you can do for literally almost free, that can have a huge impact on your hormones in terms of the circadian rhythm. Dietary stuff's obviously a big thing. So, I mean, if you're eating a standard American diet, you're eating a bunch of garbage, too many refined carbs, bad seed oils, things that, okay, for some people they're otherwise considered healthy, right? But for your body individually, it doesn't necessarily like it. That's where like different types of food intolerance testing can come in handy. I could have an avocado and do fine with it. You can eat an avocado and maybe your body mounts like sort of an immune response to it, right? Just because it's known to be healthy doesn't mean it's always good for the individual, right? So when I have those panels, lots of times people are reacting to yeah, I mean, banana, turmeric, just things that like spinach, things that we think is healthy, on top of some of those common allergens like eggs and meat and dairy and all that kind of stuff. Another thing would honestly just be, I'm not affiliated with this company, but I just like to use this as an example, is I think those young living people have kind of things down in terms of some of the environmental stuff. So all those kind of non-toxic cleaning supplies that they use and hygiene products that they use, that's getting rid of a lot of different endocrine disrupting products
Yes.
or ingredients. And then, yeah, I mean, in my consulting practice, I go kind of to the nth degree with people a little more. And I'm talking about like, even like, this is a little bit on the fringe as well, but like just too much electrosmog that we're just literally surrounded by 24/7. I don't live in a cave. I use a cell phone. I use technology, but there's ways that you can be more cognizant of it. There's ways, I mean, if you want to go really deep into it, there's ways that you can, I mean, really hack your environment and your home to really decrease it and actually do measurements of it too. But it all depends on what's going on with the person, what their goals are, how far they want to take things. But there's a lot of things you can do for hormones aside from just going to a pharmacy, going to a compounding pharmacy and getting some bioidentical hormone replacement.
Right. And it sounds like all the things you were touching on, a lot of them were kind of reducing the body's inflammatory response. You know, for example, doing your food sensitivity panel, which I recently did for myself, and it was a game changer.
Yeah.
You know, because that's causes inflammation, and that, you know, response.
Well, I'll just piggyback off of that is like, if you've got a ton of inflammation going, well, your body's under stress, right? So it's going to like, it's going to try to compensate for that. It's going to produce a bunch of cortisol, which is anti-inflammatory, right? And then, yeah, I mean, it's just like too much inflammation. It's a known thing that it affects the HPA axis, hypothalamic pituitary adrenal axis. And that goes back to what I said about the concussions. Like if you got a bunch of inflammation in and around those areas, in those systems, that's going to affect your hormones in a huge way.
Wow. And then you mentioned the circadian rhythm, that's kind of like going to kind of being connected with Mother Earth, like sleeping with kind of the sunset and sunrise, which affects your melatonin production and your thyroid, correct?
It affects literally literally affects every single system and organ. Like, I don't want to bang on too much about this because I talk about circadian rhythm on too many podcasts, but here's what I will tell you is, this is the example I always give is I don't care what condition, if you're listening to this, I don't care what condition you've got. If you've got Hashimoto's or you got IBS or you have an autoimmune condition another autoimmune condition, or you're depressed or you're anxious or blah, 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 fatigued. Unless you're like, okay, you got a true genetic disease, like you got Huntington's disease. Literally every new disease, diabetes, every new disease we're seeing exploding, there's a broken circadian rhythm component. And you can confirm that by basically type in a Google box, type in Hashimoto's and circadian rhythm, type in depression and circadian rhythm, type in bipolar and circadian. There's a whole branch of medicine and science that it's for the last 20 years it's called chronobiology. And they've been tying broken circadian rhythm, which is your body's timing, as a component for all these diseases. I'm not suggesting that all these diseases are because of that, but that is part of the picture.
Right.
And those types of conditions, a lot of them are complex conditions. It's pretty rare that it's just one thing that's causing those conditions. It's a symphony of a bunch of different things working together, essentially. So that's why, like I talk about my sort of coaching consulting practice, is we're hitting on, like I've got patients who are like, they're bought in, they're ready to do some work. And we're hitting on all those different types of things. We're addressing all those things like nutrition, lifestyle, environment, routines, hormones, a ton of different things.
Yeah. And it sounds like, yeah, minimizing anything that's causing that external stress or inflammation in the body. And then, you know, kind of going from there.
Yeah, and sorry, I'm not trying to take this over, but there was one thing that you said that kind of like triggered something for me. Is a lot of times now in like the health and wellness space, people are like, well, the mindset's kind of like, well, what can I take, or what's that one thing that I'm missing, or what diet do I need to add in? When in reality, a lot of people, like, you need to subtract a bunch of stuff. You need to subtract like bad food. A lot of the times you need to subtract some of the supplements from the huge grocery bag of supplements people are taking, because that's throwing them out of the whack. You need to subtract different behaviors and habits. And then some of those like environmental stressors that I alluded to with the young living people, all the crappy things in your environment, your cleaning supplies, your bad hygiene products, electromagnetic field. So you can get a long way without adding anything in, and just starting by subtracting a bunch of crap.
Absolutely. Yes. Getting rid of all the stress toxins in your home environment and that you're using daily or ingesting. Now,
Yeah.
besides kind of the naturopathic way, what are other treatments that are used or medications to kind of help those with an imbalance with their hormones?
Again, depends on the type of hormone imbalance, but yeah, I mean, there's lots of different nutraceuticals, herbs, or nutrients that you can use to bring hormones into balance. Sometimes it depends on the severity, right? If someone has like, they're really bottoming out and they have a pretty busy lifestyle, it's like this is what I tell people is I totally understand why sometimes people don't want to use an exogenous hormone, like using hormone replacement. Totally get it. But this is what I would tell you from my experience, from what I've seen, and this is just my opinion. If you are completely burnt out and you're running on empty, and you're like, okay, well, I just want to use herbs and supplements to try and get this back in, and diet and lifestyle, it's like, yeah, sometimes you can make some headway. But on the opposite end of that coin is sometimes it's like you give someone a protocol like that, and it's like they come back in 6 weeks, 8 weeks, and they're like, yeah, nothing's changed. And this is what I tell people sometimes is it's like, unless you're going to quit your job and you're going to go hang out on the equator down, or hang out in Mexico, in Cancun or whatever, you're not working, you got no stress, you're going to lay in a hammock all day, you're going to eat amazing clean food, be in the water. It's like sometimes a little bit of hormone replacement to kind of top you up, so to speak, is not the worst thing in the world, right? Sometimes, aside from doing what I said, like it's kind of hard to sometimes to be in a place where you're feeling optimal as best as you can without a little bit of hormone replacement.
Right.
Not that I push that on everyone.
Right. But that's a great point. And I think it's important to understand, that we can do all the natural stuff, but we might need, like you said, the extra little bit, because we can't live in the ideal environment. Our area has pollutions, there's EMFs, there's stress. I mean, we can't cut it all out, unfortunately.
Yeah.
Yeah.
Yeah. And it's all down to the individual, right? I mean, a couple people, like you take a group of 10 people, 2 of them, all you have to do is you have to get them sleeping better and things improve. Another person, you have to do a whole lot more, right, for that person to be in a place of health.
Everybody's different. And how you touched on diet, how important is diet when it comes to hormones and hormone imbalances, and what is your kind of approach to diet and the best foods to eat?
Yeah, I mean, diet's super important. It's like, that's kind of like a no-brainer at this point. I don't think it's controversial. The one thing that I like to, just the point that I would illustrate is, it's like, and I learned this from a mentor of mine, but so this isn't really my brilliant ideas, but it's just like, there's no one diet for everybody, right? Some people do amazing on vegan. You wouldn't have that huge kind of like movement on that side as proponents of that if people didn't do awesome on it. And then some people seem to do good on the opposite end of the spectrum. You got the carnivores, and then you got all those other diets in between. And yeah, I mean, there's basically the one kind of standard is there's just no one diet that works for everybody. Everybody's so different. All you have to do to confirm that is walk outside today, wherever you are in a city or whatever, when you're surrounded by people, is you just look at people, and they're all look different, which means their genetics are different, right? They have different backgrounds. They have their biochemistry runs different. Biochemistry doesn't run in the same in every person like it does in your grade 12 textbook. So everybody has different kind of enzyme function, different nutrients that they require. If you do nutritional profiles on people, it's a different pattern of what a person needs. And then you factor in the genetics too. Like you talk about all they're called SNPs, all these methylation, MTHFR, COMT, all these things. That's a factor as well. So literally there's no perfect one human ancestral type diet, at least in my opinion. And the way that I come up with an individualized diet is there's generally two functional labs I'll use that look at what your nutrition is. So it'll tell you some of the foods you want to start eating to correct that. It'll tell you some of the like, okay, the really deficient things which you do need to supplement for. You can't eat, sometimes you can't eat enough of the foods to correct. And then there's like a really good allergen panel that looks at both foods. It looks at even chemicals that can be in our food packaging. It looks at different preservatives and even just different food constituents that can be in multiple foods. So that'll tell you what you want to take out. And then the third thing is something called your oxidative type, which there's kind of three main types. And basically it can give you an indication of, okay, well, do I need a little more protein or should I eat more fat? Or should I eat a little more carbs? Or what should my macronutrient percentages be? So there's a couple ways you can measure that. You can use a ratio of lactic and pyruvic acid on a particular test. You can find that out from a hair tissue mineral test. But those are kind of the three big steps I do is a allergen panel, I do a nutrient panel, and then a way to look at what your oxidative rate is.
Wow. That's really, really in depth. I mean, I've only scratched the surface with myself on that, doing kind of the, what foods do I kind of have sensitivities, and just taking those out and reducing inflammation. I've seen huge results. I can't imagine the process that you go in depth into.
Yeah, and the one caveat I'll give you there is it's not like everyone needs to go to those lengths. I mean, like a lot of people can there's people walking around who eat McDonald's every day and they don't appear to have a health problem in the world, right? I mean, maybe let's check those people in 10 years. But if you're a sick person, there's a lot of things you need to leverage. And maybe like generally sicker people that I'm working with, that's the type of template that I'm like trying to show them how much they can do in terms of getting really individualized.
Right. Makes a lot of sense. And what would be some actionable steps for somebody who does have a hormone imbalance to take to move forward?
One thing is, especially women with menstrual problems, like simple thing is make sure you're having a bowel movement every day. I consider if you're not having a bowel movement every day, you're constipated to me. If it's every second day, you're constipated. I think the actual definition of constipation, I think it's more 3 days technically. But you need to be getting rid of those wastes. You need to be getting rid of, you need to be clearing your bowels and all the different breakdown metabolites of hormones that your liver's kicking out. And a second thing I could say is just make sure you're consuming enough. You don't have to go crazy on it, but make sure you're getting good quality fats. Things like olive oil, avocado, coconut oil, butter, ghee, omega-3 fats from fish, seeds, nuts, that kind of thing. Try and eat a varied diet. Don't eat the same things over and over again. I know it's simple to fall into that kind of routine, but what you can do every time you go to the grocery store, like this week, I'm going to buy different species of leafy greens or different species of potatoes, or I'm going to get different protein sources. I'm going to do some pork and fish this week, and next week I'm going to do some beef and bison. Just try and give your body different sources of nutrients, just so over time you don't get those imbalances. Try and shop on the outer kind of aisles of the grocery store. Avoid the really refined things, kind of the no-brainers, too much sugar, too much refined carbohydrates, because that's going to affect your insulin response, and that's going to have a huge impact on downstream on other hormones. Sleep, get good quality sleep. And then I've alluded to this a bunch of times, but the stress, again, easier said than done for a lot of people, but find some type of thing that helps you deal, or at least modulate stress a little bit, whether that's meditation, or you have hobbies that help you get your mind off stress. Yeah, those are some pretty foundational things that people can do.
Such a great start. Now, one of the really important hormones for men is testosterone. What's the role of testosterone in the body, and some of the signs of low testosterone in men?
Yeah, in terms of the role, testosterone, men and women, it controls, has a big impact on libido and sex drive. It has a big impact on mood, energy. It has an impact on just anabolic functions like putting on muscle, strength, that type of thing. But some of the signs that you often see, and yeah, it's kind of well known now that it's sort of an epidemic of lower testosterone for people, especially males, because of too many environmental estrogens. That's one component of it. Stress, again, said it multiple times on here. Poor nutrition. But in terms of signs is like, okay, like too much, especially in males, too much adipose tissue, too much abdominal fat, fatigue, depression, anxiety, weakness, low sex drive for sure, poor erections. Yeah, I mean, I think that's, and this is the thing, is it, you don't necessarily need to be like outside the range and low for you to start exhibiting those symptoms. Sometimes you can just be suboptimal and low in the range, but as long as you're within that range, your doctor's like, oh yeah, you're good, right? And there's ways with some of those reference ranges, there's ways where it's like, okay, well, let's get you kind of in the upper 50%, upper 75%, kind of upper quartile. And a lot of times that can make a huge, all the difference for how a person's feeling is getting hormones in an optimal range as opposed to just being normal, right?
Yeah, right. Yeah, makes a lot of sense. And what are some of the root causes you've seen that cause low testosterone in men? Stress is definitely.
Yeah, that's obviously in there. Yeah, the environmental estrogens, just like stop using, go in terms of your hygiene products, just go to like a health food store. You don't have to get anything fancy, but just get products that just have minimal ingredients, right? That doesn't have a bunch of ingredients on the back that you can't even pronounce. What else? Like just too much blue light at nighttime that impairs your melatonin. And melatonin, what's not very well known about melatonin is it's an aromatase inhibitor. The more melatonin you have, it'll stop testosterone from converting to estrogen, because that's how estrogen, one of the ways you produce estrogen is from testosterone. So literally people like looking at their screens at nighttime, that impacts testosterone levels.
Right. So the blue
another one, like honestly, pardon?
So use the blue blockers and limit screens.
Yeah, exactly. Like another one, honestly, like cell phones in your pocket. I'm a stickler for this one. I never walk around. I always have my phone in airplane mode. I make sure my Bluetooth's off, my Wi-Fi's off, and the cellular. I don't know. I'm just a stickler for that. I know that there's like rat studies where that seem to really impact testosterone levels. And I think just from a like kind of common sense thing, that's not a great idea to do. You wouldn't walk around with your cell phone taped to your ear all day. So why are you putting it in your pocket? And like, why do you think that's a good idea right next to for men and women, right?
Yeah, that makes a lot of sense. And what are some great kind of other lifestyle habits to kind of, prevent low testosterone? I guess we kind of covered a lot of them already, but
I mean, these are more fringe ones too, but like I mean, getting enough sun, like getting safe sunlight, right, can improve your testosterone levels. If you want to go a little extra mile, you can get completely buck naked, and just like literally sunlight and the infrared and red light on the family jewels, essentially, that's known to improve testosterone. Obviously, you don't want to burn, right? Because that could be a bad thing. But yeah, I mean, light. There's studies where it's like all this red light from the biohacking world, like literally, like you can improve testosterone by just applying that to essentially the testicles, right? That'll improve testosterone. Cold therapy, that one's a little bit of that. The window for that, like you can easily do too much. But I think what the mechanism with cold therapy is, it actually makes you more sensitive to the testosterone that you do have. Yeah, I don't know all the science behind that one, but that's another one. Exercise, weight training for sure. You don't want to over exercise because it can go the wrong direction. But yeah, those are they're free for the most part. And those are other lifestyle things that you can do.
Beautiful. That's interesting. Sunlight. in the area. And does that include just sunlight, or what about those? I know they have those kind of infrared light places you can go and get in. Does that work too, or is it just sunlight?
No, you can use like, what's the infrared spectrum? I think it's like 700 nanometers up. Like, I don't think sitting in a sauna is directly, because that's infrared light, right?
Yeah.
There's near and far infrared. I can't remember exactly off the top of my head, but those red light beds, that kind of thing. Those, yes, that's what I was referring to with the red light arrays and things like that. That there's a dose response to that. You can overdo it, but depending on the power of the thing, yeah, like 5-10 minutes a day can improve testosterone levels.
Wow, great to know.
Yeah.
Now, what is the best way to contact you?
I've got an Instagram account. It's at Dr. Clayton Bostock ND. I've got a website, just www.claytonbostock or drclaytonbostock.com. And then I do a lot of writing, or used to do a lot of writing on my Facebook profile. It's just Clayton Bostock. You can friend request me. I accept most people. But those are essentially the ways to, those are my social media, and through my website, there's a contact form as well.
Wonderful. And I'll post links to all those below. And then you did mention at the top of the show, you are in the Vancouver area, but you also do teleappointments, which is amazing. And for those who would like to work with you, what is your kind of intake process look like with a new patient? Or what are the steps?
Yeah, so for most patients, like I offer, it's like a kind of a meet and greet call, where, I mean, I'm not gonna give you any treatment necessarily, but basically we just touch base about what's going on with your case. And if it's something that I have experience with, feel confident I can help you with, there is a first step that I do for my patients. It's essentially, it's a case review is the first thing we do, where we're, going in depth into your case and reviewing previous labs you've had. And then we come up with essentially a plan from there in terms of the labs we want to do. I am a pretty big lab person to begin with. I want to get some data first to find out like where we are kind of in the journey. And then that helps us make decisions in terms of like, what direction we're going to go.
Wonderful. And you also do in your practice anti-aging as well, I read.
Yes. Yeah. That kind of goes back to what I mentioned. Like, some people that come to me, they want to optimize, right? So yeah, I mean, a lot of that anti-aging encompasses, just the different nutrition stuff, hormones for some people. Not everybody needs hormones or hormone work necessarily, but really it really just comes back again to the individual.
Absolutely. Everybody's body's different. That's why it's so important to see a doctor like you who has that holistic approach and does all the extensive testing and really figures out what's best for you individually.
Yeah. No,
well, wonderful.
Sure.
I will post links to everything below for those of you who would like to contact him. And thank you so much for joining us today and sharing your wisdom on hormones. It was so insightful, and hormone health is such an important topic to understand and learn how to manage when it comes to our vitality and quality of life. So thank you so much.
Yeah, thank you very much for having me. It was fun.
Remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And remember, I'm not your doctor, so don't take this as medical advice. If you have specific questions about your specific case in your healthcare, feel free to reach out to your practitioner. Also, if you like this video, please like and share with others. This information could really help someone you may know. And hit that subscribe button to be sure you don't miss out on our future shows. And stay tuned for the next episode of Discovering True Health.